What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. Today, I have a very special guest who's going to tell us all about hand surgery as well as plastic surgery and how those two kind of came together for him. And also some tips for everyone else out there. Dr. Galvez, thank you so much for joining me, man. How are you doing today?
Hey, I'm doing great. Thanks so much for having me on the show.
Absolutely, man. Go ahead and introduce yourself and tell everyone who you are and kind of what you do.
Hey, how's everyone doing? My name is Michael Galvez. I am currently doing a pediatric hand fellowship at Texas Scottish Rite Hospital for Children. And I am, I'm at the end of my journey of training. It's been quite a long road. I started back in 2000. I graduated from high school and didn't do very well. Went to community college to start off. I transferred to UC Berkeley, did some years of research at UCSF, and then went to Stanford for medical school. And it was there that I decided on going into plastic and reconstructive surgery. And actually, before I even went into that field of plastic surgery, which I can get into a little later, I knew really early on that I was interested in hand and upper extremity surgery. And the reason I knew that is shadowing as a medical student, and I got to go on a trip abroad. And this trip was in La Paz in Bolivia, and it was a trip really focused on pediatric hand surgery. And I saw, my parents are from Peru, but I was born here in the United States. And I just saw a really big need in this country and this community. And there was a lot of children with burn contractures and congenital differences that I saw the hand surgeons that they were able to treat it and able to help these kids and their families. And so I knew that going into my residency that I was interested in hand surgery. And so after my residency, I did a fellowship in hand surgery, hand and upper extremity surgery at the University of Washington in Seattle. And so I spent the last year, after a 6-year residency in plastic surgery, I spent the last year at the University of Washington training in that. And so now I'm here in the last 6 months doing pediatric hand surgery at Texas Scottish Rite.
Got you. So, man, that's trying to add up all those years. You're what, PGY 9 or 8?
It's a 7.5.
7.5? Man, okay. So, what was it about plastic surgery that got you interested in? You kind of mentioned some of the things for hand surgery, but why plastic surgery?
Yeah, that's a great question. So I definitely looked into orthopedic surgery. So there's different ways that you can get into hand and upper extremity surgery. You can either be a plastic surgeon, which the training is usually within 6 to 7 years. You can be an orthopedic surgeon, which is 5 years. And then you can even be a general surgeon. It's a smaller percentage of general surgeons that are hand and upper extremity surgeons, but that can take anywhere 5 to 7 years to do your residency. And so, as a medical student, I really made it a point to figure out what surgical field I was most interested in. I actually had ruled out neurosurgery as an undergrad. I had shadowed a lot, and I realized that really wasn't a good fit for me. And when I started my medical school at Stanford, it was there that I met several plastic surgeons and realized that was a better fit for me rather than orthopedic surgery. And what I tell students is you really want to look at the bread and butter and whether that interests you. And for me, plastic surgery, which is very hands-on, open surgery, we do reconstruction from head to toe, from craniofacial surgery to breast reconstruction for patients with cancer. Hand surgery, obviously, there's abdominal wall reconstruction, lower extremity reconstruction. And I realized that I like the soft tissue stuff. I like working with my hands and suturing skin and doing microsurgery. Rather with orthopedics, what I saw was it was much more focused on bony fixation, arthroscopy, and I'm sure you get into that a lot, Dr. Webb, but orthopedics is a different field. And when I tell students is look at the bread and butter and what they do on a day-to-day basis. And for me, plastic surgery made a much better fit for me.
Got you. So to become a hand surgeon for either, like you said, plastics or a general surgeon or orthopedic surgeon, but for plastics, it's 4 years of med school and then 6 years of residency for plastics.
Correct. Yep.
And an additional year of fellowship to become a hand surgeon.
Yeah, and that's exactly right. And it's actually a competitive process. As you know, I think you just match into spine surgery, right? it's like you're applying again. It's, medical school, you feel like you're applying to residency again almost, because it can be that competitive. And they do it, it's not just to be competitive, it's just that, there's only a certain amount of spots that they think, are needed in the United States. There's only a certain amount of training programs, and there can be a lot of people interested in it. And so for hand surgery, it is a field that I think people are interested in. They like the content of what hand surgery encompasses, and I'll go into that a little bit. But the hand surgery fellowship they're all 1 year. It's a match process, so you have to apply and interview several places across the United States. And it can be quite competitive. The orthopedic surgeons, actually, they tend to interview even up to 15 to 20 places.
Wow.
And that's hard enough to do in medical school. In residency, it's even harder.
Yeah.
And the plastic surgeons tend to interview about 10 to 15 programs. And so it's a competitive process to get into hand surgery fellowship. And when you're looking at these fellowships, you want to figure out, who the mentors are in that specific program, where the location is, what type of pathology that they treat, what really interests you in that field. As far as getting into the specifics of hand surgery, so it's a field of medicine that includes obviously the hand, but also the wrist and the forearm as well. And some of these fellowships even include the elbow. And it's a region. So what hand surgeons like to stress is that it's not just working with one specific tissue. With the hand, you think of the way that I like to explain to patients actually is, when we look at our hands, you see that it can open and close, make a fist. It gives you the ability to do function, but there's a lot of tissue, different types of tissue in there. And so that includes skin, your bones, ligaments that hold the bone together, tendons that allow your fingers to move and extend. You have some muscles in there. Then you have nerves, you have arteries, veins, and that's a lot of different tissue types that you have to deal with. And so that's why your training becomes important. As a plastic surgeon, we do a lot of microsurgery. We do a lot of soft tissue stuff. And then as an orthopedic surgeon, you do a lot of bony fixation and arthroscopy. We even do wrist arthroscopy. And so hand surgery, when you're looking for a fellowship, you want to figure out what fits better for the type of training that you had in residency. So for me, I had done a plastic surgery residency. And so I was very comfortable with soft tissue things like an ulnar, cubital tunnel release, which is releasing the ulnar nerve at the elbow. Done, 100 of those in residency. And then my fellowship was a orthopedic fellowship where we're dealing with the actual elbow, and we're dealing with releasing these complex elbow contractures, or doing a Tommy John surgery, doing ligament reconstruction of the elbow. And so with hand surgery, you want to think about, the soft tissue stuff as well as the orthopedic parts, because they're all important, because they all have to be in a perfect balance to provide the best function for patients.
Got you. So you mentioned plastic surgery, you mentioned hand surgery, and also pediatric hand surgery, but you also mentioned the programs that you went to UC Berkeley, Stanford, and WashU. Was that WashU?
University of Washington.
University of Washington, and also Texas Scottish Rite, which are top programs overall. What do you think it was about your application, or what kind of set you up for success in all of these, not only the top specialty, but also the top programs for these specialties?
That's a great question, man. So I think the key to my success, and this is, why you're so active and in social media and telling people, that are interested in our fields, like the mentorship. I think that is the most important thing. And that's something that I focused on as well on social media. It's having someone that has done what you're interested in, and for them to help you get on that path to figure out what the right choices are. And you're right, like I've been very blessed, lucky, hard work. It's all combined in order to get into these programs. I did, like I mentioned before, I did terrible in high school, had C's in all my classes, A's just in PE essentially. And I finished college without a clear way of, finished high school without, knowing my way or knowing what I was going to do in life. And I was lucky, and I miraculously got this job working in a basic science lab. It was a genome sequencing lab. And I was motivated. I was like, whoa, science is fascinating. I think I'm a good fit for this. And so that built on for me to do a major molecular cell biology at Berkeley. And so I worked hard, and I had mentors there in that lab that took me under their wing and were like, you should take these classes. And so and on top of that, the resources that community college had, which were awesome. So I got my act together, transferred to Berkeley. And then when I finished Berkeley, I knew I wasn't really ready for applying for medical school because I hadn't really been inside of a hospital much. And so there I say taking years off, but really it's taking years on. And it's time on, it's time that you're active. I did research at UCSF, and that's when I figured out that I wanted to do surgery because I was doing hands-on things, working mostly on mice-based research in the lab, but I realized that I like working with my hands. And so that's where I actually met a plastic surgeon who was taking hand call at UCSF, and he took me under his wing. He had this is a guy that I just, was assertive. Like I met him once in the ER and I was like, hey man, can I get your email when I'm applying to medical school? I'd love for you to help me out. Yep. And he took me under his wing. And so when I applied for medical schools, he really helped me out. And I ultimately ended up at Stanford. And it's a similar thing. It's just seeing the opportunities that are there and just taking them. Like that guy was just there. I just asked him, and there was no downside to that. And when I went to Stanford, he helped me set up working in a research lab that was a plastic surgery research lab. And so by working there, I gained mentors in the division of plastic surgery that took me under their wing and were like, these are the best steps for you to move forward. The particular mentor, I have many mentors at Stanford, but the one that was particularly important for developing the path forward for hand surgery was Dr. James Chang, who's the chief of plastic surgery, and he's a hand surgeon. And he gave me, a plan of, you're in residency. You're gonna work hard in residency, and that's obvious. But to get into this hand surgery fellowship that's competitive, I want you to do this specific thing in research. And so he guided me and helped me figure out what I was going to be doing in research to make application more competitive. And then ultimately I ended up in this adult hand surgery fellowship. And then, he knew in the back of my mind, my story, like I liked that experience that I had working abroad in Bolivia and La Paz was really important for me. It's what got me interested in hand surgery. And so pursuing additional training in pediatric hand surgery, which is congenital patients that have congenital differences are born with, without a thumb, where we can make them a new thumb, or they have a trauma to their hand or a burn. That patient population who I was interested in. And so he helped guide me to determine, I actually, for all these steps, like somebody else told me like, hey, you should check this out. And this fellowship is the one that he recommended, and it's been awesome. There's been a ton of patients that I've been able to help take care of, and learning how to best take care of these kids. And so each step that I've gotten, and you mentioned all these schools, I have specific people that I can thank for and mentors that have helped me get there, and not only get there, but succeed so that I can move on to the next step.
Gotcha. That's awesome. I think that's well said as well. Having a mentor in whatever particular field that you want to go into, someone who's already been through that particular path is essential. And the reason why I do this is to show people that there's, different things out there. Like someone may not even know what a hand surgeon is, or that that's even a possibility until they see something like this. So that's awesome.
And I applaud you for your efforts, because that's exactly right. Like you meet students, and not everybody needs to be an orthopedic surgeon, right? Not everybody needs to be a plastic surgeon. This is just the field that I chose based on the experiences that I had and my interests. But everyone, I truly believe that most people can fit into if they're interested in medicine, they can fit into one part of medicine, and that not only includes just medicine as being a physician, but, it can be nursing, it can be a physician assistant, it can be a specific field in medicine, but there are so many ways to help people that I really think that, just like you're doing, like exposing people to different things. Like I said before, I love telling people this. I thought Cal was a football team.
Yeah.
Like legitimately, I thought Cal was a football team. I had no idea that it was at the time the #1 public university that I was driving by, every week growing up. And so that's crazy. So the fact of just knowing about a field, I think is helpful, and so that's why I think, I'm very happy to help you, because hand surgery is a really small field, but for people to know about it, it's important. Like, it's a cool field. Like, there's a reason I've been dedicating so much time. You don't have to take as long as I've taken. With this extra long route, but it's a cool field. I mean, you can go straight from medical school, do an orthopedic residency, and do a hand fellowship. I'd be done a lot sooner than I have, but it's a field that you can go into as well. And I've chosen this longer route, but it's been great. I think I'm going to be hopefully ready to take care of kids.
Absolutely. This may be a two-part question. Number one, kind of what's next for you, and also, do you plan to do some general plastic surgery, or just sticking to just strictly hand surgery once you're finished in the next couple months?
Yeah, that's a really great question. So plastic and reconstructive surgery, like I mentioned, you can do a lot of things. The most common things people will consider are craniofacial, which is taking care of kids with cleft lip and palate, or bad congenital anomalies that these kids can have. And that's mostly a pediatric field, craniofacial surgery. You can do microsurgery, which a lot of it's breast reconstruction and a lot of other complex reconstruction. You can do cosmetic surgery, and so that's a big one. That's one that most people, when they hear plastic surgery, they think immediately, of Dr. 90210, Nip Tuck, and then Dr. Miami. You don't even have, these are like famous surgeons at times, just because of the media. The media is so powerful. And but the reality is that most plastic surgeons are doing a variety of things. They're doing some reconstruction, some cosmetic. The reality is most are doing cosmetic surgery. And cosmetic surgery is great too. You can do facelifts, breast augmentations, tummy tucks, and that can fit a plastic surgeon really well, and they can have a really satisfying career of taking care of these patients. And so as far as my practice, I will be doing just pediatric hand surgery. So I'll be working at this hospital it's called Valley Children's. It's in Central California, right next to Fresno. And I'll be focusing on developing a program in pediatric hand surgery. I definitely will be doing some component of general pediatric plastic surgery. And that has to do with providing coverage for kids that have, let's say they have a tumor resection of their leg that the orthopedic oncologists have done. I would be in charge of providing coverage, which means just moving tissue around in order to salvage a leg. That's just one example. But it will be a smaller component, but I'm hoping to focus on pediatric hand surgery. And it's amazing. I've been here for 6 months and I've never read. So I've actually been here for 3 months. It's a 6-month fellowship, but there are so many papers. There's so much detail in a specific field that I know I'm going to be busy enough focused on this.
Gotcha. What type of advice would you give to someone who's either interested in medicine, maybe plastic surgery, or just hand surgery? Maybe you can lump it all together. What type of advice would you give to them?
Yeah, besides be proactive about finding a mentor, like I mentioned, the advice that I love to say over and over again is, if you're interested in medicine, if you're interested in the healthcare field, the best thing you can do is to not watch medical shows. Like, don't watch Grey's Anatomy. Don't watch Amsterdam, whatever's just come out, or The Resident. That's even worse. I'll leave my opinion to myself. But medical shows are great. But what you need to do is save that time and find a shadowing opportunity, or make one. Like, you can literally make a shadowing opportunity. And shadowing just means you've contacted a doctor. I'm a fellow. I'm currently in training. I'm not done training yet. And Dr. Webb is a resident. Like, you need to find attending physicians, people that have been out in practice for a while that you can contact. And you have to be proactive. You find their email, you send them emails, you give them a CV, you show up, you're assertive, and you're like, I want to follow you around for a day. And then you set it up so that you're following this person around. You're like a fly on the wall. And then you think of it, they don't have to be exactly like you. They don't have to look exactly like you. But if you can imagine yourself as them, then you're that much closer to being motivated and to finding an opportunity and seeing where you fit. And I said this earlier, like I had ruled out a field of neurosurgery as an undergraduate student because I had shadowed neurosurgeons, and I didn't know much about what neurosurgeons do, but I was able to realize that I just wasn't as interested in the pathology in the patient population as I was in these other fields. And I did that as an undergrad. So that's a lot of power if you're able to kind of figure out where you fit in sooner, because then you can start. I mean, I mentioned my plan of how I've gone through this process, but once you figure out sooner what you may be interested in, you can start, beelining, getting closer and having a dedicated plan to try to achieve it. And that's why, these interviews that Dr. Webb's doing is so important, because you're able to kind of get a glimpse of what these people do and what these surgeons or physicians or people in the medical field do, and figuring out like, hey, should I shadow that person? You got to do more than watch videos. You got to get out there. And you got to do it in real life.
Gotcha. That's very good advice. 3 last questions. I'll ask this of all my guests. You can give a 1 or 2 word answer. What is your favorite thing to do outside of medicine?
My family.
Your family?
I have 2 kids and a wife, and so as soon as I go home, that's the first thing I run to. So it's been incredible.
What is your favorite food?
Peruvian, but I'm
food.
Exactly. I'm totally biased.
Yeah, as a spot in DC that I always went to. I'm actually looking forward to going back when I go back to DC to the same spot. Yeah, one of my favorites.
That's awesome, man. Have you been to Peru before?
Never, but I want to.
Well, you got to do that, man. So that's where, you have Peruvian food every day. It's amazing.
Yeah. And do you have a particular interest in pediatric hand surgery? Is there, like for me, for orthopedic surgery, spine is kind of my interest. Do you have a particular interest? Something that kind of, that you're really fascinated by in pediatric hand surgery, one particular condition or?
Yeah. I'm definitely somebody, in being a plastic surgeon, you're very good at knowing a lot about things and liking a lot of things, but that's a really good question. For me, I think it's not this, but it's different. This is different than probably your answer as far as the pathology. For me, it's, I really enjoy the patient population, and I really enjoy working and talking with families. So like the surgery stuff, I've been training for that. I know how to, just like you know how to use your hands to achieve a goal technically, and what you've read and your knowledge. The surgery part is fascinating to me, but what I really enjoy is when you're sitting down with the patient and developing a plan with their family and being like, this is what we think, and this is what I think is the best plan moving forward to improve your child's life. So in order to provide them the best function for their hand. And that doesn't always include surgery. It sometimes includes no surgery and giving them different tools, whether it's therapy or prosthetics. And so that part I actually find the most fascinating. It encompasses everything. I'm giving you an answer that is not very, but that's the part that I enjoy the most. It's like, how can we figure out to improve your problem? There's some really cool operations that we do, like cleft hand closures or polycizations. Brachial plexus is actually a whole nother field that I enjoy. But I gave you a terrible answer, but that's my answer.
No, that was actually a good answer, because you need something like that to keep you going, and what keeps you grounded, something that you can look forward to every day. So I think that's very important and a very good answer. But if there's anybody out there that wants to get in touch with you, or social media or contact, how can I do that?
Yeah, so the best means has been social media. So the Instagram has been the easiest way for people to contact me. So it's at Michael Galvez MD.
Okay.
That is definitely the easiest way to contact me, and I'm happy to help in any way. So.
Got you. And I will put the link to your Instagram description, to your Instagram profile in the description. Dr.
Awesome.
Galvez, thank you so much for joining me today, man. I appreciate it. You're a real inspiration to a lot of people out there, including myself. So thank you, and congrats on all your success this far, almost being done as a fellow. So,
hey, thanks, man. Appreciate it. Have a good day, Dr. Webb. Appreciate it. Appreciate it.
And everyone else, thank you for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. We'll see you next time.